One of the most significant advances in prostate cancer has been the introduction of molecular targeted imaging. In particular, in the past 2 years, we've had fluciclovine and PSMA scanning come into play. Hooked up with this has been something called theranostics, where a therapeutic agent is tied to PSMA. Some studies that have been done with Lutetium Pluvicto resulted in FDA approval almost a year ago, actually 10 months ago, and also with other carriers. The results of this have been phenomenal, and like supply and demand, there's been a real challenge lately with delivery of the drug. Joining me are two friends, a medical oncologist, Bryce from the Mayo Clinic, and also Bryan Mehlhaff from Eugene, Oregon, who is a urologic oncologist. Both have had extensive experience with Pluvicto, and I'm going to ask them to comment on what's going on and what they see as the way forward. Start out with Bryan.
Sure. So, it's always nice to have another therapy. Patients are always reaching for what's the next thing as they go through their journey of prostate cancer, and to have a test, PSMA scan that'll show you disease, both soft tissue and bone, and then have a theranostic that'll actually go treat that metastasis is enormous. And so it's really been a game changer for some patients that are multiple lines of therapy. It can really impact their quality of life and actually quantity of life too. And in my experience, having patients, about 10 or 12 now, some of them have really been very challenged patients, and it's amazing how they respond. So it's just, you worry whether you'll ever be able to treat them.
This, unfortunately happens. We've seen it in oncology before. We have something so effective. Alan, your thoughts about it? You've had a lot of experience with it, and what are the challenges, and what do you think our way forward is?
Yep. So it's a tough moment for patients. If patients are watching this, they're well aware of the fact that supply is now restricted. So, it's a manufacturing issue, and the current information we have from the manufacturer is that, they're not accepting new starts. So we can't refer new patients in to receive it. For the patients who are already midstream on treatment, we're having treatment delays, but we're still getting doses delivered. But the delay might be a month or more in some cases. So it is an ongoing management issue that we have to address on a case-by-case basis. For an individual patient, is the delay going to be problematic or not? Can we continue on therapy? Do we have to change? And that's going to be a clinical decision that the physician is going to have to make with the patient. But I agree, when we've had drug availability, it can be a wonderful drug for some of these patients, less toxic than the principal alternative, which for these patients is probably second-line chemotherapy with cabazitaxel. And when it's effective, all the benefits you'd expect: improved quality of life, improved overall survival. But the point about the time is relevant here. I mean, this is a patient population in whom the overall survival is about 12 months.
Right.
So if we have a 6-month delay in getting access to the drug, there's going to be a population who are going to miss out, unfortunately. And so this is a major issue, a major conversation in the clinic today. And what it means for the treating clinician is it takes us back to where we were a year ago, right? We didn't have the drug a year ago. We had to do other things, and so those other things are still in play.
It's certainly nice to have this available and have this opportunity, but it's like a lot of things. The supply can't keep up with the demand because it's so good. It's certainly not the first time we've seen this in medicine.
This is a complicated molecule, right? Radioligand therapy. You've got an isotope. You've got the linker, the chelator. You've got the targeting molecule. But the isotope supply is really the most difficult piece of this. So it'll be an ongoing issue, and we're hopeful that as the U.S. manufacturing facility comes online, that the supply will be adequate.
Well, you can't take a shortcut here. It has to be 100%, and so
Right.
we understand what's happening, and hopefully we'll solve it soon.
Yes.
Any parting comments, Brian?
I want it back. I want to have it in my quiver again.
Yeah.
No, you don't hear that very often. Thank both of you.
Thank you.